I'm James Hyder. I'm a patient advocate with Lung Cancer Foundation of America, here with Dr. Jacob Kaufman. Welcome.
Thank you so much for having me. I'm Jacob Kaufman. I'm a assistant professor in thoracic medical oncology, so a lung cancer specialist at the OSU James Comprehensive Cancer Center, and a physician scientist who does research in lung cancer.
It's been awesome getting to know you better and learning your work. Can you tell me a little bit about what a patient ought to ask a doctor about biomarkers?
So let me tell you about kind of how I think about, or what a biomarker is. So really when we use the term biomarker, it's kind of shorthand for clinically actionable biomarker. So a biomarker could include a bunch of other things, but the ones that we really care about, clinically actionable means it helps your doctor make clinical decisions about how to tailor the treatment for your cancer to you and your cancer specifically. And in really over the last 20 years, understanding which biomarkers a given lung cancer patient has been critical to both getting them to the best possible standard therapies as well as a range of clinical trials.
Gotcha. So I'm starting to get that having your biomarker, knowing what it is really important. Can you just speak a little bit more to that?
Yeah, so and the whole every year there's probably going to be some additional biomarkers, so things that are kind of in the emerging biomarker category where maybe they're not being used to make decisions now, but we think that they could be. Let me start with sort of a different type of biomarker and then transition to what most people think about when you're talking about like patient groups and support groups in terms of a targetable biomarker. So there's another category where knowing the PD-L1 status or knowing the tumor mutational burden or knowing the MSI status, those are three biomarkers that are important for kind of understanding how much benefit there's going to be from immune therapy. But I think for the purpose of this conversation, most patients, when they're thinking about what's my biomarker, they're thinking about mutations that happen in the early evolution of the cancer, where the mutation really drives the progression of the cancer. And for some of these, EGFR, ALK, ROS, RET, KRAS, BRAF, and some others, there are, in many cases, oral therapies. In most of those cases, we're talking about oral treatments where the drug is not killing every cell, not killing every cancer cell, but only a cancer cells that has that mutation biomarker. That's what it's like, a key and a lock sort of thing, where the mutation, the drug only works if it fits into the part of the protein that's the mutation.
So it sounds like not all lung cancer is exactly the same. It's like a whole bunch of different things.
Thank you for saying that. That's a really great way to put it. Every patient's lung cancer is different from every other patient's. But by understanding the biomarkers, we can help get the best treatment, the most effective treatment delivered to the patient who's most likely to respond.